signs your legs are getting weaker after 50 and what to do about it. Watch someone walk down a flight of stairs. You can tell almost everything about their leg strength in 5 seconds. Does their knee cave inward? Do they grab the rail before they even need to? Do they drop the last 2 steps instead of controlling them? Most people over 50 are losing leg strength right now and don't know it. Not because anything dramatic happened, no fall, no injury, no diagnosis. It just happens quietly, one missed workout and one easier shortcut at a time. Sitting down a little harder, taking the stairs a little slower, leaning on the rail a little more. By the time it's obvious, you've usually lost more than you think. I'm Will Harlow, a physiotherapist specializing in working with people over 50. In the next few minutes, I'm going to walk you through the 7 clearest signs that your legs have gotten weaker, most of which you can check on yourself, right now, today, and exactly what to do about each one. Hashtag the 7 signs weak legs aren't really one problem. They usually come down to 3 muscle groups: the front of the thigh, the back of the hip, and the back of the calf. When one or more of those groups lose strength, it shows up in very specific, recognizable ways. Here are the 7 I see most often in clinic. Hashtag 1. Loss of power when walking. This is usually the first thing people notice, even if they can't quite name it. You used to keep pace with your walking group, and now you're trailing behind. You used to push off the ground and feel some spring in your step, and now it feels flat. People overtake you on the pavement who never used to. This comes down to your glutes and calves losing the ability to generate force quickly. It's not necessarily that you can't walk, it's that you can't accelerate. That power is one of the first things to go and one of the first things you get back with the right training. Hashtag 2. Tiredness after stairs, especially going down a little fatigue after several flights of stairs, is normal. What's not normal is consistent heaviness or aching in your thighs every time you climb or descend even one flight at home. Pay attention to whether it's worse going down. Going downstairs requires your quads to control your body weight, as it lowers. Physiotherapists call this eccentric strength. It's a different skill from simply pushing yourself up, and it's commonly the first one to weaken. If descending stairs is harder than climbing them, that's a strong clue about where to focus. Hashtag 3. Dropping into a chair instead of lowering yourself. This is one of the easiest signs to test on yourself and one of the most telling. Stand with the back of your legs touching a chair. Lower yourself down slowly without using your hands and try to land without making a sound like a feather touching down. If you can control the entire descent, your legs are doing their job. If you get halfway down and then drop, or if you find yourself leaning on the armrests every time just to manage it, that's your quads and glutes telling you they've lost some of their control. This one matters more than it seems. People who lose this ability gradually start using their arms to do the work their legs used to do, and the legs get weaker as a result. It becomes a cycle. Hashtag 4. Your knee caves inward on stairs. Get someone to watch you go down a single step, or film yourself on your phone. Look at what your knee does as you lower yourself. Does it travel straight forward over your toes, or does it drift inward toward your other leg? That inward collapse is called knee valgus, and it almost always points to weakness in the hip, specifically the muscles that keep your thigh bone aligned, your hip root. When those muscles are weak, the thigh isn't held in place properly, and the knee drifts in to compensate. It's subtle, but it puts extra strain on the knee joint over time. Hashtag 5. Your knee occasionally gives way. This is different from a fall. It's that moment where your knee briefly buckles while you're walking or standing, and you catch yourself before anything happens. It happens because your quads are responsible for keeping the knee locked and stable when you're bearing weight, and if they're not strong enough for the demand you're placing on them, they can momentarily fail to do that job. It's also one of the more important signs to take seriously, because the muscles aren't always there to catch you a second time, and the next thing that stops the fall is the ground. Hashtag 6. A side-to-side hip wobble when you walk sunroom. Ask someone to walk behind you and watch your hips, or watch your own reflection in a shop window. Does your pelvis stay roughly level, or does it dip down on one side with every step? That dip is called a Trendelenburg gait, and it's caused by weakness in the glute muscles on the side of the hip, specifically the gluteus medius and minimus. Their job is to keep the pelvis level while the opposite leg swings through. When they're not strong enough, the pelvis drops, and you get that recognizable side-to-side sway. #7. Visible muscle loss, especially just above the knee stand in front of a mirror, and tense both thighs at the same time. Look specifically at the area just above and to the inside of your kneecap, a teardrop-shaped muscle called the vastus medialis. In a well-conditioned thigh, this area sits slightly raised. When it's weakened, it can look flat or even slightly sunken compared to the other leg. This muscle is one of the most important for keeping the knee stable, and it's also one of the quickest to lose size and strength after an injury, a period of inactivity, or simply general deconditioning. Comparing left to right in the mirror is one of the simplest ways to catch an imbalance before it becomes a bigger problem. Why this happens? None of this is really about getting old. It's about disuse. After about age 40, muscle naturally loses mass at a slow, steady rate if it isn't actively trained, but the speed of that loss is almost entirely in your control. Muscle works on a simple principle: use it consistently under enough load, and it maintains or builds itself. Stop challenging it, and it adapts downward just as efficiently. The reason these 7 signs cluster together is that they all trace back to the same small set of muscle groups: quads, glutes, and calves, and those groups tend to weaken together because daily life simply stops asking enough of them. Most people don't lose leg strength because something went wrong. They lose it because nothing demanding happened for a long time. The encouraging part: these muscles respond to training at any age. Strength gains in people in their 60s, 70s, and 80s are well documented and often happen faster than people expect because there's more room for improvement. What to do about it? Exercise. This is the most important lever by far. The priority is resistance training for the 3 muscle groups behind these signs: quads. Sit-to-stand exercises, the same movement as the chair test above, done slowly and with control, step-ups, and once you're ready, squats. Glutes, side-lying leg lifts, clamshells, glute bridges, and single-leg balance work to train the hip abductors specifically. Calves, standing or seated calf raises, gradually adding more repetitions or single-leg variations as they get easier. 2 to 3 sessions a week is enough to see real change within a couple of months. The key is progressive overload, gradually doing a bit more over time, whether that's more reps, more sets, or added resistance. Protein. Muscle needs adequate protein to repair and build, and protein needs actually go up slightly with age because the body becomes less efficient at using it. Spreading protein across meals rather than getting it all in one tends to work better for muscle maintenance. Daily movement habits. Take the stairs instead of the lift when you can. Practice standing up from a chair without using your hands, even when it would be easier to use them. Park slightly further away and walk. None of these alone is dramatic, but consistently choosing the harder option keeps the muscles doing real work. When to see a doctor or physiotherapist. If your knee is giving way frequently, if you've had a fall. If one leg looks significantly different from the other, or if pain is involved, it's worth getting an in-person assessment rather than guessing. A professional can rule out anything else going on and build a plan suited to your specific situation. Where this leaves you, none of these 7 signs are permanent, and none of them mean something is broken. They're signals, a way of catching weakness early, before it turns into a fall, an injury, or a loss of independence you didn't see coming. The people who address this early are almost always the ones who stay mobile, confident, and steady on their feet well into their 70s and 80s. If you noticed yourself in 2 or 3 of these signs, that's useful information, not bad news. It tells you exactly where to put your effort. Try the chair test and the mirror test today. They take less than 2 minutes combined, and they'll tell you more about your leg strength than almost anything else you could check at home. If you found this useful, let me know in the comments which of these 7 signs you recognized in yourself. I read every one. And if you want a full walkthrough of the exercises mentioned here, that's exactly what the next video covers. Thanks for watching, and I'll see you in the next one.